Dr. Mitchell, as I'm sure you are aware, our country faces a maternal health crisis, and this crisis disproportionately affects Black women. Let me say that again, Black women. Black women are 3 to 4 times more likely to die than white women from pregnancy-related causes. We have the worst maternal rates compared to all other wealthy countries, and over 80% of these deaths are preventable, and that is absolutely unacceptable. We've received relentless criticism on medical school education involving diversity, equity, and inclusion from my colleagues across the aisle, while ignoring this indisputable fact. Education that includes DEI teaches doctors about implicit racial bias, culturally competent care, and expands their knowledge of the patient populations that they will be serving. But most importantly, it saves lives. The Momnibus, which I co-lead with Congresswoman Underwood, is a comprehensive approach to this crisis and would get at the heart of these issues. And that package includes my bill, the Kira Johnson Act, which would fund implicit racial bias training, respectful maternity care, and compliance programs within hospitals. So social determinants of health are really important. But we need a strong partnership with medical schools if we can hope to really address this crisis and empower the doctors of tomorrow. So Dr. Mitchell, could you speak briefly more about this crisis, as well as the role of DEI in medical education and what it plays in addressing it?
Well, similarly, I served as the chair of the Maternal Mortality Review Committee in this city, where we've seen this firsthand, and your point is well taken. I met Kara Johnson. I know her. And so these issues are extremely important for us to understand the particular social construct. I'm saying the same thing over and over again.
Yes,
the importance of diversity, equity, and inclusion curriculum in our medical schools is a patient quality issue.
Okay,
it's a patient safety issue.
So for my colleagues across the aisle to suggest that teaching doctors about the social determinants of health or structural racism is political activism completely ignores the data on maternal mortality. A physician who cannot accurately address how systemic barriers affect their patient's health is fundamentally unequipped to provide high-quality care. A physician who is unaware of their own personal biases is one who can unintentionally cause significant harm. So could you explain briefly, got 10 seconds, how medical school can fully prepare future physicians for the realities of modern clinical practice?
Through skills-based cultural competency curriculum.
Thank you, sir. I yield back, Mr. Chairman.